So this is a, again, kind of looking at our study data, comparing EndoRotor and conventional endoscopic necrosectomy. What we did is we used my former institution's cost model for not only device cost, but also the anesthesia protocol of our particular institution. And what we did is we took every device that we use in the middle of the procedure, including EndoRotor catheters, the upfront capital purchase of the EndoRotor device, as well as any costs of snares, nets, etc. And we also looked at when it came to the total procedure time. So we looked at the anesthesia start time and the anesthesia stop time, and we calculated using our institution's protocol and cost models how much that was. And so if you look at the two columns here between EndoRotor, which is the first column on that left, and then the conventional, which is on the right, the anesthesia cost per procedure was the same. Now, remember when we went over my data earlier on in the presentation, the total procedure time, so scope in and scope out, was roughly the same between both groups. The main difference was the total debridement time per procedure, which was actually shorter in the EndoRotor group. But this is interesting. The total anesthesia cost per patient is significantly lower than in the EndoRotor group than in the conventional group. And why is that? It's because you're doing fewer cases, so less anesthesia time. Obviously, the conventional devices are going to be cheaper than the EndoRotor device will be. So you can see that device cost per procedure and patient is significantly lower in the conventional group. When you take all the costs together, the total intraprocedural cost per patient, about $12,000 in the EndoRotor, roughly $15,000 in the conventional group, which was not statistically significant difference. But next slide, please. When you extrapolate those costs per patient over the long term and over several patients, you start to see where the EndoRotor really does become cost effective here when it comes to the intraprocedural costs. So the upfront capital purchase obviously sets that blue bar, which is the EndoRotor curve, a little bit higher to start than the conventional necrosectomy group. But you start to see at patient number 7, you start to see that curve favor the EndoRotor curve. And at patient 11, you start to see a statistically significant difference in the cost. So we like to say, at least this is what the data suggests, that intraprocedural costs are less in EndoRotor depending on the number of patients that you're performing necrosectomies on. Now you extrapolate this data even further, lower number of procedures, you're able to get patients out of the hospital quicker. Theoretically, you're also decreasing overall cost per patient, and especially hospital burden and patient burden, because you're getting them out sooner with EndoRotor. That study that we're still working on compiling right now, and that'll be presented in the future. But I theorize that not just intraprocedural cost, but overall cost of care with regard to necrosectomy definitely will favor EndoRotor.